Jonathan Levitt, one of the partners at Frier Levitt, as well as John Morrone, head of our Life Sciences Regulatory Group. Today we're going to be talking briefly about the COVID-19 pandemic and its impact on the healthcare and life sciences industries.
John, a number of guidances that have come out from the federal government allow waiver of copay or reduction of patient responsibilities, which really historically has been viewed by the federal government as very problematic and in some cases a crime. But now we have clear guidance that providers, pharmacies, physicians can waive copays. How does that actually work when you're dealing with pharmacy benefit managers on the life science side?
Yeah, I think there's definitely cause for some caution and pause by pharmacy providers. Pharmacy providers are subject to all these different rules. You have Medicare and CMS have guidelines, and they've relaxed some rules. But then you have some state laws, and you also have the PBM manual. The PBM manual is very clear. It says you collect that copay, or we can terminate your contract. And we know, as you know, of many instances, hundreds, where pharmacies didn't collect copay and were terminated by the PBM. Now, the PBM manuals also say that this contract should be interpreted according to changes in the law. And if the law changes, you would think the PBM would honor that change in the law. But if you're at a pharmacy and you're a technician and you go up to your computer terminal, the software, and you go to bill a Medicare claim right now, we are told by our pharmacies that it still comes back and says, collect a copay of X dollars from that patient. And so we would like, on behalf of pharmacies, or even national associations or state associations, to communicate with PBMs and say, what is your stance on the recent CMS pronouncement? Are you actually following this? And are we safe to waive copay in these defined situations for these patients?
I'm confused. The other day I was watching the business news and the CEO of CVS was on, and he said that their pharmacies are waiving all of these copays. So if they are also the PBM, isn't it automatic that other pharmacies in their network can just waive copay?
It would be nice if that were the case, but obviously you have CVS Health is the parent company. They own a PBM Caremark. They own CVS retail chain pharmacies, and they own the biggest PBM Caremark. They also own their own plan sponsor, SilverScript, which is a Medicare plan sponsor, and they also own Aetna, one of the biggest plan sponsors out there. Unfortunately, sometimes CVS, the PBM Caremark, sometimes they make their own rules for their own internal purposes. And very often, they make terms that are better for themselves than their competitors who are also in their network. So it's this vertical integration of a plan, an insurance company, a chain, a PBM, and especially pharmacy, all under one roof. And each of the big PBMs are structured the same way. You have Cigna Aetna, you have United Health and Optum, you have CVS, Caremark, and Aetna. And this vertical consolidation makes these decisions much more complex for pharmacies who think they see the CVS CEO on television saying, well, that's what we're doing, meaning at CVS. That doesn't necessarily mean that they've drafted a contract that says what their competitors in the network are allowed to do. So it's a bit of a concerning situation for pharmacies.